Belenje, and thanks for joining. Thanks for joining us for this press conference. We have with us Dr. Subhadra Jalali. She is the Network Director of Newborn Eye Health Alliance at LVPEI Eye Institute. We have Dr. Akash Belenje. He is the retina consultant at the Anant Bajaj Retina Institute of LVPEI Eye Institute. And we have Mr. R Ugandhar Reddy, Senior Optometrist at the Anant Bajaj Retina Institute of LVPEI. So these are all retina specialists, and the reason why we have invited you all today is to share two important news and updates which we are very excited about. One is that LVPEI Eye Institute across its network centers has achieved an important milestone, that is managing 1 lakh babies for retinopathy of prematurity. It's a blinding eye disease in infants. And this is one important milestone towards our endeavor to prevent avoidable blindness in newborn babies. And the other milestone to mark this occasion, we are also launching an atlas which we will be sharing with all of you. This atlas is about ROP and also about diseases, neonatal diseases in infants. So having established that context, I will now pass on to Dr. Subhadra Jalali, who would be interacting with all of you. She has a video and a presentation to show. She will give you some background about what is the significance of this milestone, and after that we are open for questions.
Andarki namaskaram, dhanyawadalu. You all came. Thank you so much. आप कहाँ से हैं सर? Somebody else join. आप कहाँ से हैं? You are with me? आप इनके साथ में?
Yeah.
So I will just tell you that lot of information that we get about newborns, eye disease, or in general about children is coming from the West. And I have been working in this field since 1998, and I have always been saying in different fora that maximum children are born in India. 23 million children every year are born in India, in case you don't know. All made in India. We are the highest in the world. Number one. So the world should not teach us how to take care of children. We should be setting up the standards, we should be setting up the protocols, we should be telling the world how to take care of children, because we get so much experience. And our diversity of the population, diversity of the economics, diversity of the terrains, so many things come up which the world doesn't see. So our endeavor is to showcase to everybody that we have a lot of children, we care for them. Of course, as eye specialists, we care for their vision. And we are very pleased that in addition to what Neha said, recently WHO was looking for a video to train health workers, general health workers like ASHA workers, how to check the eye of a newborn. So unfortunately, it is not taught in our curriculum. People are scared. Even at home, the doctors will check all the organs, but they will not check the eyes when the newborn baby is born. And it is very difficult to know just by looking at the child whether the child is blind or not blind, because children are so active. Even if they see little, they will just run around, and you can't make out that this child is not seeing well. Even in good families, so many times parents come with the child and we tell them your child is not seeing well, and it is a surprise for them. They don't know. Because see, if the child has some heart problem, he will become blue, or he will get breathing problem, or if he has some feeding problem or gastrointestinal problem, lungs problem, everything will show up. They will vomit or they will be lethargic. But just remove your glasses, like world is blurred. A child cannot tell the world is blurred. So when they get eye problems, most of the eye problems, especially in small children, newborns, they are silent. There is nothing from outside you can make out that child has a problem. So how does a health worker who is looking after these 23 million children look after these children? And we are very happy that out of all the videos, WHO has selected our video, which I will be just sharing about general information on newborn eye health and what we have to look for and how we can just know whether a child needs eye checkup or not. Because all 23 million cannot come to eye hospital. So we have to have some way of knowing, and then we will flow into what we are doing. So it is in English, but I think it's very simple English. Because this is for health workers, it is made in very simple language for general public, so that everybody can understand.
I close it.
not just for public, this is for all of us. Because all of us are going to have children in our family, in our neighborhood, our certain children, our sisters, brothers.
Bro, light
It's a good opportunity to know about eye health.
Light.
Lights of children.
Okay.
The eye health screening is a crucial component of the overall health assessment of every newborn. Soon after the baby is born, the health worker attending the baby should screen the baby's eyes along with the other health checkups. The follow-ups are also equally important and should be done at every subsequent health check visit. The same test should be done again and again at every checkup. This video is going to demonstrate two relatively easy eye tests that can be performed on the newborns by any health worker or even a family member. And if any abnormality is detected during these tests, then the infant should be seen by an eye specialist at the earliest. But hygiene first. The hand sanitizers alone are not sufficient to eradicate viruses from hands. Hence, the eye examination should be done only after thoroughly washing the hands with soap and water and then drying them appropriately. This should be repeated both before and after checking each baby's eyes. Unclean hands or wet hands will spread infections from one eye of the baby to the other baby. Also ensure that the examiner doing the examination does not have long nails that can injure the eye. Always remember to dry your hands after using hand sanitizers, as these should never come in contact with the eyes. So let's get going. The first test is a simple torchlight examination. Gently open the eyelids apart without pressing on the eyebrow or the bone region, and do this in a child when they are happy and well fed and they are not crying and crying. Check one eye at a time, and when you want to compare both eyes, then open them simultaneously. The parts of the eye that will be visible are the iris, the surrounding area including the lacrimal sac area, the conjunctiva, which is the outer covering of the eye, the cornea, that is the front transparent part of the eye, and the front part of the eye behind the cornea called anterior chamber. The pupil, as all of you know, is in the center of the eye, and then the iris is the colored part of the eye, which is often blue or brown, and which gives the color to the eye. And then the lens, which is a transparent layer behind the pupil. Now, what do we want to look for? We want to look for the size of each eye. Are they equal? Are they normal looking? Is one eye smaller or bigger? Then we check the lacrimal sac. Usually, children who have lacrimal sac problem will get discharge watering from the eyes, but you can check for it by gently pressing the inner corner between the lids and the nose, as shown in this video, and look out if there is any pus or mucus coming out from the underlying lacrimal sac around the eye. If there is any difference in the appearance of the eye, or there is defect in the eyelids, or swelling around the eyes, or any discharge, redness, transparency of the cornea is lost, or the clarity of anterior chamber is not there, or the shape and color of the iris or pupil, then these are abnormal. Normal pupil should be round and central, and the center of the pupil should be transparent, and the color of the iris should be same in both cases. If any abnormality is detected during this torchlight examination, then the infant should be sent to eye specialist at the earliest. This test, torchlight examination, can detect many common eye problems in the newborns, and so it is something which can be done, but it is not normally done. Now, the more important test is the red glow test. Now, the red glow test, it helps in detecting a few more common eye diseases and more serious diseases in these babies. After the torchlight is done, put one drop of 1% tropicamide eye drops 2 times in the eyes of the baby, and this should be done 15 minutes before the red glow eye examination is done. This eye drop helps to dilate the pupil safely and sufficiently for the test. Alternatively, if we don't want to put an eye drop, then we can do the red glow test by keeping the baby in a completely dark room for a few minutes. These pupils will dilate in the dark, and then we can get the red glow, but sometimes this may not be sufficient for all babies, and that is why by using the tropicamide eye drops, the test becomes more easy to To check whether there is a red glow in the pupil or not, one can use either a digital camera or take a closer photo of the eye, or more commonly what we like to use is a direct ophthalmoscope that all doctors use to check eyes of patients. A normal eye on photography and on ophthalmoscopy will show that the center of the pupil has a bright orange-red glow, which you also sometimes see in bad photographs, that a red color comes with the eye, the red eye. If there are abnormalities of this red glow, then it may look white, which is called photophobia, or yellow, or no glow. If the glow is different to two eyes, that is also abnormal. In such a case, the pediatric eye specialist or the specialized specialist should be consulted at the very earliest because these are serious eye problems. Now, while these tests that I have described will be able to detect any visible abnormalities in the eye, they will still not be able to detect any serious or rare eye problems in the inner parts of the eye. To detect these, all high-risk babies must undergo complete fundoscopy or fundus by a trained eye specialist or trained health worker. In addition to these two tests which should be done in every newborn. So what are these high-risk babies who need more detailed examination? First of all prematurely born babies must undergo a retinal examination within 20 to 30 days of birth, and this should be done by an expert who is trained in ROP. ROP is a serious blinding disorder and the babies become blind within 2 to 3 months of birth. So all premature babies as defined by your country's guidelines must undergo examination within 20 to 30 days of birth. Those infants who are detected to have any other congenital abnormality, that they are born with some abnormality like incontinence or infancy, or they have some syndrome or a metabolic problem or genetic problem or multiple fingers or heart problem, any problem if the child has been detected to have, then they should also undergo eye examination because many times the eye is involved in these diseases and also the eye can provide the clue to the diagnosis. Those babies where there is a family history of the parents, siblings, first cousins or other close relatives like uncles who have had eye problems in childhood or young adulthood, they should undergo a very detailed eye screening, and in fact, if the elder child had an eye problem, then it is better for the parents to have more detailed discussion with the doctor even before they become pregnant next time or during the pregnancy rather than waiting for. Now, infants who are sick, that means they were admitted in hospital with infections like HIV, like some eruption, virus infection, rubella, septicemia. If they had IV line, that is saline, for more than 2 weeks, then they are at risk of developing infection inside the eye, which can remain hidden and which can be treated if detected on time. So these children also should have very regular close follow-up for eye infections, and they need a detailed fundoscopy. The last but not the least, the babies who are not having eye contact or don't follow an object as we see in the video, or have an abnormal eye movement, that is the eyes are moving up and down or they're shaking or they're looking sideways after 6 weeks of birth. And those children whose mothers complain that something is wrong with the eye of my baby, these babies must have detailed eye screening done, including fundoscopy. What we have noticed is that it's usually the mothers who suspect and notice eye problems months ahead of others, including doctors. We hope that this video will help to save many eyes from going blind and help the health workers to detect the problems with the babies early enough to receive treatment. If there are any questions or queries, please feel free to contact us through the email provided at the end of the
So, any questions on the video? So, I hope you will encourage all your children and newborns in the families to get a basic eye examination done. It is not done, and because of that, India has the largest number of blind children anywhere in the world. And it's not done not only in India but also in very developing countries. But in the Western countries, it is normal. All newborn babies get eye checkup done by the nurse or the grandmother or the doctor there, whosoever is attending the birth. Within 24 hours of birth, they will not discharge the baby till they have done all these basic tests. So I think we have to do ours. So I will be just giving this presentation and then we can have the questions. So we come back to the topic of today, which is like 1 lakh babies. It's not a small number. So these are the numbers. I think they have been given in your press note also in there, so that will be total there. And this is being done both at our car campus here in Hyderabad and also in Odisha, which is the next largest program we have in Bhubaneswar and surrounding districts, and also in Visakhapatnam and Vijayawada. And then we are very proud that in last few years we have done almost 10,000 babies in the rural area. So our team goes every week to Siddipet, Sirsila, Barampur, from Odisha, Ganjam, so many places we are going to cover all the children, whatever is possible. And wherever we get permission, we send our team to see these babies, and that is how we have come up with this. Because previously, these preterm babies were only in big metros, all the IVF centers, test tube babies were only in big centers, but now we know it is going into rural areas, into smaller towns also. They are having incubators and IVF centers, so the children are now in those areas, so we have geared up to do that. But I want to just highlight that these numbers, for us, they don't mean just numbers. They highlight all the 5 values which we as LVPEI Institute have set up as our values. And these values are not something very difficult. These are normal, humanitarian, good, person's values. It is our heritage, it is our lineages, that the patient should come first. We should have excellence, we should have equity. That means everybody should get opportunity to get the treatment, and there should be integrity, there should not be any falsehood, and then we should all work together. These are our 5 values, and I will just show that this 1 lakh baby that we have done is a output of these values, which we practice day in and day out. Patient first. Even during COVID times, and you can ask Akash, he has got award for the work we have presented in multiple conferences. We were one of the few hospitals in this whole region of Southeast Asia where not even for one day we stopped our care of newborn babies during COVID times. You remember, I think we have forgotten, it was very serious time, people were scared, nobody was going out, but our team did not stop. We set up the programs, and Mrs. Tapas in Bhubaneswar, this is him with PPE doing that laser in that baby. It takes 4 hours and we can't switch on the AC. So with that, they just took care of all the babies. Every hospital shut down, including all days too. They did not take care of babies. So many babies became blind. But we continued our work and we did not stop. COVID didn't stop us. And what we did was that we set up systems, our team in different centers, that is Amira from Vijayawada, she built that box in no time so that the baby can be safely seen inside that box, and the doctors and the babies don't infect each other. Same way, as I said, teams, we built these visors, so many innovations, there is no time to talk about them, but yes, it was a challenging time and we took it up, but we didn't stop. We said ROP children going blind is emergency and we are going to take care of them in all the outreach programs. That brings us to togetherness. Such a marvelous work cannot happen with one person. I am only the outward face of what the teams on the ground do. Our students, our fellows, our counselors, they are on the job all the time. We are only one phone call away. If we get a phone call, we make sure that our team goes and takes care of them. We have an active surveillance. We started in 1998 in Hyderabad, and now it is in all the other centers also. Every week our team goes, and initially we were covering all the hospitals of the city. 20 hospitals, starting from Vasansami to Fernandez to Rainbow to Nilofer to Gandhi. All the 20 hospitals from morning till night, we used to go and check every baby in those hospitals. Now we have trained many teams in the city. Now we don't go to all the hospitals. We still cover many of them. But now there are other doctors we have trained, and they are taking care in their own places, so we don't have to go in the traffic. But yeah, we got a phone call from somewhere. I got a phone call. Baby is there, it cannot come to you, can you come? I said, yes, where is it? They said, Nalgonda. I have no idea where Nalgonda is. I just told, get the taxi and we'll go. When we started, then I came to know, okay, it is 100 miles away. But that's fine. Every baby is important. Every age is important. So that togetherness of our team all the time, the secretaries, everybody knows that if a baby calls, they will not be sent back. Whether it is Sunday, whether it is holiday, we are there all the time for this thing, that no baby will go back from here if they come in their place. And it's also the integrity of the fellows, because they go to these places, they don't mess up things. Till date, in last 30 years, we have not had any single complaint about lack of integrity of our fellows. They collect the money, they come and deposit it here. We don't have digital payments for these outreach programs because we never know who's going to call us and where we are going. So for those hospitals where we have MOU where they call regularly, they pay directly, but for others, the fellows have to go, they collect that money. And till 30 years, they're so happy that no complaints of embezzlement of funds or not taking care of the patients. So there's a lot of hard work going and a lot of integrity required to do that work sincerely when nobody else is watching. There's nobody watching them, they're expected to do that and they do it. We're very, very proud of them. And same thing for the data collection. So every baby's data, we are one of the few places in the world where right from day one, everybody's data we have in our data set. And as I said, so some of it comes digitally, some of it is manually registered, and Cyclin is here and other people are here who are data entry operators. They make sure that every data of every baby is collected and put in our systems so that we can look at it, we can learn from it, we can share it to people. So we are one of the few places where it's called Indian Twin Cities ROP database, and all this data that we have from day 198, it is there. And excellence, I don't have to talk about excellence. I think when you deal with such tiny babies who are 1 kg, 900 grams, 500 grams, like this, like it just comes into your hand. And then you imagine what is the eye, and what is the size of the eye. It's about 14 millimeter or 15 millimeter, like 1 centimeter. And then how we manage these babies, how many hours of peering into that eye, your shoulders, your nose, your mouth, your head, everything is aching. But when the child sees, all that hard work just goes away. And we've had many testimonials. Of course, the parents, they are very thankful. So that's not important. But important is that the team is always upgrading their skills. They're always looking at their results. They're looking at the data very minutely. We have regular meeting every month. We see how we can do more and more better. And if there's any gap, we make sure that the things are audited and we overcome those things. So we do for the city also and for us also. So these are a lot of testimonials. They are on the YouTube also, you can see a lot of them there. Equity, these are 3 babies, triplets, born in Khammam, and nobody told them that your eye needs to be checked. You can see these stories on the YouTube also about triplets. And then the father was googling about preterm babies, and by chance he saw one of my videos, and then he brought them here, and they had no money. If you have to treat 3 babies who have advanced disease, it will cost them 2-3 lakh rupees. But we are very happy with Cognizant Foundation and so many other foundations. We are working very hard to get funds from them. And LVPEI Institute's motto is that nobody will be turned back for want of money. So irrespective of the bill, we are doing it free so many times. And as I said previously, these are city people, they have money. Now the disease in the rural area, we have more challenges because more poor people are coming up from those government centers where they are getting there. So we are aware that we will need to raise more funds. And we are writing reports. And one day I went to one government hospital, so they said, "Arey, all the funds come to LVPEI and they don't come to us in government hospital." I said, "You know why they come to LVPEI? Because 3 o'clock in the night we sit and send that report on time to the donors. So it's not coming just because we are a big fancy center. It's coming because people are sweating it out. They are writing those grants, competitive grants, and getting that money so that you don't have 3 blind children in the family. But you have 3 beautiful, lovely kids. And we have videos of the father playing with all these 3 kids now. They're all 3 seeing and they are beautiful. So we believe in equity. And then all this work has had ripple effects. So we have been able to do training and skill enhancement of almost 350 doctors. So this work on ROP I trained in USA. It is not available as part of normal curriculum in our PG program. So there were no doctors who were trained in this. I also was not trained. I did PG from PG Chandigarh in 91. Until 98 I had no clue how to even look at a baby's eyes, leave alone treat it. So it was in 98 that we saw 12 blind babies from our city. When we became aware that this is a new disease, we have to get skilled. Now we are very happy. We are the first person in the world to have 1 month hands-on program open to all the doctors of the world. And we have trained large teams from China, from Azerbaijan, from Bangladesh, from Indonesia, from Nigeria, Kenya, so many countries, and of course from almost all the states of our country, and it is an ongoing program. Every month we take 2 trainees and we train them how to do the work. And then it has also, we have trained a lot of nurses. You can see, actually we are one of the first hospitals, eye hospital in the country to have our own NICU in this hospital so that the babies don't have to go to another hospital for their general care. We will take care of them, and after seeing us, all the students set up the program. after they visited us and saw what we had done. That same way we have trained so many other people, especially the anesthetists. The youngest baby we anesthetized here was 900 grams. Nobody does it. Nobody does it. They will not anesthetize babies less than 2 kg in most hospitals. But now we are routinely doing 1100 gram, 1400 gram. That is our routine. In every OT, Akash, myself, we are doing these surgeries, 10, 12, 13 babies we are doing, and without anything. We have a track record. More than 20,000 babies we have operated, we have had 8 deaths. So our safety record is very, very high, in spite of the fact that these are very, very sick and vulnerable children. And of course, every year we do a lot of programs. Like technicians, somebody like Ugandhar, he will tell you his story. You know, he is from a very humble background. He came here like an ordinary technician. Today he is one of the best. You will see his atlas, how good his skills are to image these tiny babies, 15mm eye, how beautiful photographs he will. So enhancement, skill enhancement of our technicians, boys, girls, and they are employed and they are doing great work. And every year, because as I said, a lot of babies who are still coming to us blind, so we do awareness, and that is where all of you can help us on various days, whether it is World Sight Day or it is World Prematurity Day, which is on November 17th. Please run some programs so that the public knows that newborn baby needs an eye checkup or a preterm baby needs a timely eye checkup. And so many times parents tell us, when we ask them why you didn't come for checkup, your doctor told. They say, "Humne kabhi suna nahi." We never heard on the media. We heard about breastfeeding, we heard about malaria, we heard about polio, the good zindagi ke. We never heard about these things. Nobody told us. The government didn't tell us, the media didn't tell us. It's not coming on Lok Sabha. It's not coming on any TV. But how critical it is. And these babies, they become blind by 3 months of age. And then they are blind for life. There is no cure. There is no transplant, there is no gene therapy, there is no stem cell therapy, there is no chip implant, there is no cure. And they are not born blind. They are born with good vision, they develop a problem within 30 days. It's 90% of them can get cured if we treat them. And but there is nothing from outside, so that don't take treatment, because either nobody tells them or somebody told them but they didn't understand it. So we do run various media stories. Now the other important thing I wanted to say is that, as I said in the beginning, that India should lead the world. We should tell the world. So we are having so many publications. There is no time to talk of them, but I am just highlighting 2-3 of them. So we have described some new diseases which have not been described in the literature. So Tapas, Sushma, Komal, they have described some new types of diseases which were not there in the literature, which we are seeing only in our country. And now others in the world are trying to see, and they are also having some babies. So we have described executive detachment, and we have described death-like detachment, and these are not there in the literature. So new disease entities in preterm babies we are describing, and we are very proud that we were part of the task force Government of India National Health Mission on the RBSK Rashtriya Bal Swasthya Karyakram. Our teams were there forming the guidelines for India. So we are very proud. Very few guidelines are there which are accepted all over the country, and the Ministry of Health has released this universal newborn eye screening and ROP guidelines for the country. Our challenge is to implement it, because health being a state subject, different states are picking it up, not picking it up. So we are pushing through our various team members across the country to see that this is implemented at the grassroots level. The guideline is there, it is in the book, it has to reach the baby. So that is our mission. We are doing it. So there are so many conferences, and then as I said, what we did during COVID time, again we have published it so that it's not forgotten. And how we did it, where we did it, because we don't know when the next pandemic is going to come. It will come. And that time we should not again scramble to find new knowledge. So all the knowledge we have put there in the public domain, so that people don't have to struggle if and when the next pandemic will come. And now we are of course moving towards technology. So now we have set up, this is Tapas in Bhubaneswar, on a single day, 92 babies were screened. 92 babies screening is not a joke. Only small baby. And this they could do through teleconsults, through telemedicine. So the technician goes and he takes the pictures. They are very good. They can take the pictures safely. And then on Zoom software, the doctor is live talking to the family, telling the technician which photo to take, which is good photo. So everything is live. And then we can counsel the families, and out of those 92, few patients needed treatment and they could just be brought. So yes, we are trying to beat the traffic and reach more outreach. And this is going to be put in place very soon in all the centers. So this is the father with the triplets, so you can see, I know they can see now very well, but for us, we still have miles to go. This was our 10,000th baby from Kakinada. We could not reach her on time. such a pretty girl, and she's like, we operated her for 4 hours after surgery. Now she can see her toys close by, but that's all she's going to see. And so we still have miles to go. We have to reach every baby. And this is what we expect. If we treat well, they all see very well. It's a treatable disease, it's a preventable disease. And we hope that by 2025, at least in our 3 states, we will not have needless newborn blindness. We will work on the chart of technology blindness. And our healthcare pyramid, many of you are aware that we are in almost 200 plus locations in the rural areas. Now we are empowering our rural areas to do the screening right there, and then those who need treatment, taken care of. We are very thankful to multiple agencies from Queen Elizabeth Diabetes Trust, Government of India, Government, State Governments, Government, Additional Government, and Cognizant Foundation, Sightsaver, and many philanthropists who are helping us to achieve these milestones. Thank you. And I'm open to questions on this topic. Then we will talk about the atlas, or if you want, then we can talk about the atlas and we can have questions together. Akash, you can talk about the atlas? Yes. And Ugandhar is here, he will speak in Telugu also. I can speak a little bit. Media se
Andarki Namaskaram. So, as we know, India is the fastest growing nation. So, Madam has spoken that India is the fastest growing nation with highest number of premature babies. So a lot of things that Madam has spoken. So, main thing is documentation is very important, education is very important, awareness is very important, and most importantly, research and general public awareness is very important. Healthcare policy making is very important. So all these requires a very strong documentation. So I'll explain you one by one why documentation is very important. So just to explain what is retinopathy of prematurity. So when a normal pregnancy happens at 40 weeks or 9 months, a baby is delivered. But when a baby is delivered much before that, the retinal blood vessels, what we call as Raktanala in Telugu, is not well developed in the entire retina. So retina is nothing but the light sensitive organ of the eye. It is at the back part of your eye. So when this organ blood circulation is not developed in a baby who is born before 40 weeks or 9 months, you have this new vessel development, what we call in Telugu as Kotta Raktanala. So this Kotta Raktanala, what it does is it causes a pressure on your retina. It can bleed and it can cause retinal detachment, what we call as Naram Mudrindi. So this can be prevented, and this takes time. This is not seen on day 1 of life. So all these signs to develop, it will take at least 2 to 3 weeks to see these signs. So if we screen the baby within 30 days of life, that is when the baby is delivered, and if we do a retinal checkup, eye checkup within 30 days of life, then an eye ophthalmologist or retina specialist will pick up these signs that there is a problem in the baby's retina and requires immediate attention with treatment. So what we have come up with a very important slogan is "Tees Din Roshni Ki." That is, every neonate or every preterm baby must have a retinal evaluation within 30 days of life. So born too soon, the baby has multiple challenges now, not only eye related. The main challenge would be the survival itself. So it is born with a lesser birth weight, his lungs is not developed, so they have respiratory distress syndrome. The blood hemoglobin, what we call Rakta Kanagalu, it is less. So it requires blood transfusion, and there are chances of infection. So all these battles the baby will be facing in the neonatal ICU care. So somehow the concentration kind of deviates to saving the baby, rather than sometimes the focus of the pediatrician or the parents in examination of the eye will be lost. So the critical time of 30 days will be missed sometimes. So this is something that we must keep in mind. In spite of the baby being sick in the NICU, we at LV Prasad visit all our NICU in and around the Hyderabad city, making sure that we do not miss any baby screening within 30 days of life. So if we miss this screening and there is a delay in identifying this problem, then as I said, these new blood vessels can cause retinal detachment and the child can become blind completely. So the WHO, that is World Health Organization, celebrates the World Prematurity Day on November 17, addressing all the newborn problems, and retinopathy of prematurity is one of the major concerns that is being raised, and because it is a preventable blindness, it is needless. That means to say, if we screen and treat on time, all these babies will have near normal vision like all of us. In case we miss because of the problems or any factors that I mentioned, the baby will present with what Dr. Subhadra was telling regarding the glow examination. That is, normal baby should have a red glow. So most of these babies, if they are missed, then the parent would have noticed in the house that the babies in the camera or photographs or family photograph, they would have noticed that the white reflex, what you call as white glow. So this is a very bad sign. This means that already there is a retinal detachment, and now treatment will not get the complete vision back. Only you will get little bit of hand perception or toy perception or face perception, very less vision. So we have already missed the bus. So it is very important to screen these babies within 30 days of life. So imaging of the baby, as I said, is very important, because education and awareness is the most important thing for preventable blindness like retinopathy of prematurity, along with research and healthcare policy making and making the entire general public come to know. So how can we do the imaging of the baby? There are two methods, contact method and non-contact method. So this is a contact method. So in contact method, what we do is, so in contact method, what we are seeing is it is a portable machine. That means we can take this machine to the NICUs of Hyderabad or NICUs of Siddipet, wherever we go. It has a laptop and it has a portable camera and a portable device that the diagnostic technician is carrying. So with this, he uses this to image the babies, and you can see in the laptop those images are captured. So these images can be sent by teleconsult to the doctors, or these images can be showed for parents and the neonatologist or pediatrician for building awareness and showing that the problem is there. And the right care and the treatment can be sent immediately when we diagnose this to the place like a rural setup, where a diagnostic technician would capture these images and send this to us, and we can immediately address it with the appropriate, our LV Prasad. We have a very good team which has a very good rural outreach, and we send our team there, and appropriate treatment will be taken care there. So coming. This is a non-contact method.
This is what we are launching today.
So our book is mainly on the non-contact, because whatever the images that we have captured are from the babies that have come or referred to our main tertiary center at Banjara Hills, that is this Apex Center here, that is a car campus at Hyderabad. So this is captured. These babies are relatively stable. Although they are stable, we have to take all the precautions, because all these babies can have hypoglycemia, hypothermia, that is they can have low sugar and low temperature. So we have to take, although taking an image in a baby, we have to take all the precautions. So you can see that the baby is well covered with the clothing, warm clothing, because they are very fragile. Even in a OPD, they can go for a desaturation if we don't take care of this method. So it requires lot, along with the technology, it requires lot of tender care by our team. So all the images are captured by non-contact method. It is called as a flying baby position. So we have these devices. We have used here the Zeiss Claris 700 machine, which is a high resolution, first time true color. That means whatever is seen in the retina, exact image is being captured in this. This is for the first time in the world we have shown that a high resolution true color real time with the least time period. That is, it captures the image within less than 0.2 seconds. You can imagine these babies' eyes will be moving, they are not stable, they do not follow our commands, but still we are able to get a very good image because of the rapid capturing of this high resolution within real time. So you can see there is already a bleeding in that image on the right hand side. What we can see is already the new vessels, as I was saying, that Kotta Raktanala, it has already bursted in some areas and already it has started causing some amount of damage. So but we have picked up in the correct time. So if we treat even at this time, the baby is going to get a complete vision back. So the book starts with a very good foreword by Dr. Subhadra, where she mentions about the importance of imaging. She has reiterated on all the points that we have mentioned here. So we can connect, the audience can connect only when the color is being represented. So as I said, the book is everything about true color. So whatever color is there in the retina, exact color has been imaged. So previously the world thought that only artificial or pseudo color was used. But for the first time we have shown with Zeiss Claris that a true color machine can be used. So this can connect the parents, the parents and the neonatologist and a pediatrician, because the exact image is being shown. So as I said, wherever our network is spread in these 4 states, we are picking up these babies well within the retinal detachment. So none of our babies that we see where our outreach is there, we have seen they are progressing to stage 5 or retinal detachment. So we are picking these babies and treating them much early. So that is what we have reiterated in the first speech by Dr. Jalali, that in this COVID time, when none of the services, all the essential services were closed, retinopathy of prematurity is one of the major essential service. And we, with our team, we have gone to this outreach center wherever our network is connected and made sure that none of the babies are lost to follow-up and they got the appropriate treatment at the right time. So the book starts with this foreword and a little bit of description about retinopathy of prematurity and awareness, and also mentioning the Tees Din Roshni Ki slogan. So you can see these images. So the book has more than 100 images of retinopathy of prematurity. It is a 200 pages atlas book where not just a vitreoretinal specialist, even a normal ophthalmologist or an MBBS student or even a neonatologist, pediatrician or the general public can easily connect to this book with these images. So you can see how nicely the high resolution images have been captured in these babies. You can see this is an example where you can see the baby had a very highly aggressive kind of eye disease, but when we given an injection to reduce the aggressiveness, you can see after 1 week the exact image, it has quietened down. You can see it has become shant. It has been very aggressive here. After the treatment, it has quietened down. These vessels, new vessels have become quietened down. Similarly, we have gone through series of capturing of these images in every week of this baby. This is the first atlas where we can tell that the babies have follow-up images also. So you can see the aggressive eye which had a very vascular disease, and it has quietened down. This is the same eye after the injection of the anti-VEGF. You can see the eye has quietened down. See how vascular and aggressive and these images are there, and after treatment it has quietened down. So we have series of documentation. So there is no book till date where if any medical student want to learn about retinopathy of prematurity, they have to search for multiple journals or publication to get these images. Under the single roof or under the same book, we have given all the stages of retinopathy of prematurity and with the follow-up images also. This book is first of its kind, and it is high resolution, true color images, non-contact, real-time images. So, and we have also shown montage images. First time in the world we have shown montage image can be done. Montage is nothing but we have stitched two images of the retina to give even wider field of view of nearly 200 degrees. So normal cameras can picture about 70 to 80 degrees, but we have shown with this method 200 degrees of field of view can be captured. So we can see that here this is called as a stage 3 disease, where you can see the retina is kind of getting lifted from the side. So post laser treatment, the retina has gone back and the vascularity of the retina has come down. So this scientific paper of this atlas is also published in I London, and for the first time we have shown that this kind of series of documentation of these images. So this is our team. So we believe in LV Prasad that togetherness and teamwork is the main integrity, these are equity, and these are the things that has kept our team going, and to save these children from needless blindness. So if we screen the babies on time and treat them on time, we can prevent, as we know the medical field is advancing, so these babies lifespan will be much more than us. If we are having an average lifespan of 70 years, these babies are going to live for 90 years and 100 years because of the advancement of medical technology. But if unfortunate, if we miss this retinopathy of prematurity, they will live 90 to 100 years with blindness. We can just imagine what kind of a burden it's on the family and it's on the country. So the awareness and the message must go loud and clear that every baby must be examined within 30 days of life to prevent needless blindness. And India being the fastest growing nation, it is very important to create an awareness in the general public. Thank you.
Thank you, sir, for your patience. I'm sorry this is going on in the but it's just that our passion, I think, goes to that. So we are open.
Ma'am, 20 million newborn babies in India is born. How much percentage is RO?
One second. Screen or change.
So
Retinopathy of prematurity.
So about 15% of children born in our country are preterm. So 23 million complete total births. 15% of that, you can put the zeros. So about 2.3 are premature. In premature, 50% children will get the problem. And out of that, in 50%, in about 30% by proper treatment without actually treating the eye, but by systemic treatment, improving the weight gain, improving the mother's breastfeeding, improving the sepsis, we can cure the disease.
30%.
But with complete treatment, 90% will cure. If they come on time, 90-95%. There is a very good success rate.
What's the success rate?
So if they come on time, it is 90-95%. And we have published that data also.
Can be cured, fully
It
cured.
is fully cured. But they need follow-up. We have to see them, they need glasses later on, they need care about their life. But the critical period within 2-3 weeks, the disease cures.
Is there any research data which shows which are the states which has high this kind of problem in India?
We already know. So initially this was only, like we have our data. Initially we were seeing only children from Delhi, Bombay, Madras, Calcutta. No, Madras children don't come here, they go to Calcutta, but from other places we were seeing. And just to give a short story, from Calcutta we were getting so many children who were blind. Then we started writing letters to those doctors. We used to take time to get the address, phone number of the doctor from where they have come. And we started sending them these brochures, letters. This was in 1999. And still things were not improving. Then I went to Calcutta multiple times, did a lot of sessions, training. But today from Calcutta we don't see it as much. But now the disease is spreading to rural areas. And obviously the rural areas, Uttar Pradesh, Rajasthan, Madhya Pradesh, Maharashtra. So we are getting blind babies from newer places. So it's like as if it is spreading like fire. So initially it was Hyderabad, then we started seeing Nanded, then we started seeing Parbani, now we are seeing more rural areas, now we are seeing from Chhattisgarh a lot of babies are coming. So I think as more and more health services are spreading, so many of you may be aware under RBSK, Rashtriya Bal Swasthya Karyakram, every district has a SCM, special newborn clinic.
Primary cause you see of this kind of problem?
2-3 things. One is the premature birth. So India has largest number of premature babies, and there is no need to tell our audience why it is happening, because nobody cares for the mother. We have so much of anemia. We have children being born to 15, 16, 17-year-old mothers. and multiple births every year they will produce one child. So all these factors lead to premature births. And now the added is the IVF. Most of the IVF babies, that is the test tube babies, surrogacy babies, they deliver preterm. Okay, so they all land into preterm. So wherever infertility center is set up, the preterm delivery will happen.
What is the percentage of these preterm babies born because of fertility?
So here now we have, I don't know if you know, there is a big association of twins in Hyderabad. So now if I see a twin or a triplet, almost all of them are not natural. They are all IVF or surrogacy or whatever. So I think it's about 30 to 40%, but it depends. If it is twins, triplets, then there is more chance of, premature delivery. And also younger mothers, and then elderly mothers. Now all these women, they are postponing their pregnancies. Then they are 30, 35, older. So the more older you get, the more chance you have of preterm delivery. So the body is, physiologically built to have children between 22 to 30 years. That's the best time. Okay, but if the mother is anemic or there are some problems happening, and also sometimes the media brings up about these cesareans being done, early cesareans. So I remember my grandmother, she had 8 children, 3 of them died. So that was accepted in the society. I'm sure all of you know, children are being born, some children are dying, there is stillbirth, nobody is questioning. But today if there is a stillbirth, they will burn that hospital, they will kill that gynecologist. Nobody is accepting stillbirth, dead child. So what people are doing is they are monitoring these pregnancies very closely. Every mother is being monitored very closely with Doppler, with ultrasound. If there is little doubt, the baby has some problem, they will deliver. They will deliver live baby, and then it is headache of neonatologist to take care in the NICU, and most of these children are surviving now. So youngest child surviving in Hyderabad is 345 gram. 345 gram, 3 pav ka bachcha in Rainbow Hospital. So 500, 300 grams babies are surviving. So no gynecologist wants to have a death in the womb or immediately. So there is monitoring, and that will result in preterm death. So there are multiple factors, but there is also some thought, because this prematurity is actually increased worldwide, and there is some thought that with advanced medical care, prematurity should go down, but actually it has increased rapidly. And there is some thought, I read somewhere, I am not expert in that, but I read somewhere that they think that it is the chemicals in our food chain also which are contributing to poor maternal reproductive health. Yes, the uterus, the uterine fluid, that is getting contaminated by these chemicals in our food chain. So maybe we are paying the price of all these chemicals, fertilizers somewhere. But the assisted fertilization, IVF, surrogacy, they are definitely a big reason. And in our country, of course, as I said, the anemia, the early age of marriage, the non-importance given to a girl child's health, right from birth till, so she is just to give that boy to the family, but whether she is getting food, whether she is getting rest, whether she is getting care. Overweight is a problem. If they are diabetic mothers, overweight, BP, mothers, that affluence also will relate. The job chase karo, career chase karo, the late chase karo, pregnancy, I have a problem. Both sides, they will have problem.
That's very informative.
Yes, we all have to learn how we have to improve
What is
our...
the position in our Telugu state?
So Telugu states, 2 major cities to improve cover aindi. Big towns, almost everywhere we are having good care. Hyderabad is leading. We are very proud in Hyderabad city. I think for the last 10 years we have not seen a state pride. There were some babies coming from Nilofer. Now we are very proud. Nilofer is the first government hospital in the country to have its own team. They don't depend on anybody. We trained their team. We got funds from Government of India and we trust. They are the first hospital in the country to have their own camera, own 2 eye specialists. You know how difficult it is to create a job in government sector. We are very proud that Government of Telangana, they created 2 posts of eye specialist only in the neonatal center. That time Dr. Hima Bindu is there. She has led that program, and it is very successful. And now very rarely if the doctor is on leave or something, we are supporting. They have their own laser machine and their own camera, and the team is there and they are screening. Still some parents get missed. So as I said, the audit, if any child from Hyderabad, Secunderabad or surrounding areas comes to us and he was not screened on time, if they come on day 31, even if they are not blind, they have to be checked by 30 days. If they are checked after 31 days, we do an audit and big letter goes, and you will know from many doctors in the city that parents will come in rain. I will say, why did you come in rain? No, doctor cheppara me yellow madam ki letter vastundi. So 10 letters go to doctor, they have to screen by 30 days. We are not allowing 31 days. So we are very strict, we are doing very strict audit. So in our twin cities, it's very good. In rural areas, recently from Nirmal we got some blind baby. So I think that is tribal area, so we have to still reach out there. Pushpagiri hospital and our hospital, and now for Nandi's hospital, they also set up their own team. We are now empowering them to do the camera checkup by their own team. So yes, manpower is required, money is required, cameras are required, but most important is the heart. Once the heart and mind is there, we can achieve. But yeah, in rural Telangana, rural Andhra, still there are many centers, both private and public government, where screening is not happening on time. So it comes later, like, ideally, this ROP, first baby, first incubator of the world, just go to net and read about how the incubators came. They came from chicken hatching. The chicken used to be hatched and then some doctor put babies in that same thing. The first incubator in a hospital was set up in Boston Children's Hospital in 1941. The first blind baby of ROP was from Boston Children's Hospital in 1942. So 1940s we know, if incubator is there, blindness will come. So what should normally happen, that when the incubator is set up, with that the eye specialist should also be set up. But that is not happening. That is not happening in any of our developing country. In developed country, they will shut down the NIC. They will not give it license. You cannot set up a NIC or a baby care center in the West unless they show one eye specialist is coming every week to check the eyes. They shut it down. They don't want blind babies. But that is not happening here. Here the NICUs are set up or the SCNU are set up. Then after 1 or 2 years, they think that okay, now some blind babies are coming. So already babies have become blind. Then they start thinking we have to get the eye specialist. So what should happen is that when the program for the babies is putting in place, we are putting vaccination now. When we set up child center, we are putting polio. We are putting DPT. We are not saying when 10 babies will get polio, then we will start polio program. So same thing, polio is for the leg, eye screening is for the eyes. Sarvendriyanam Nayanam Pradhanam. Right? So I am not saying that leg is not important, but isn't eye more important? So why should the blindness control program for babies not be in the same time when the NICU set up? You open a child hospital, you set cardiology there, you set neurology there, why you are not setting the eye? It should be part and parcel when the setup comes, so that is not happening. But still, at least we are happy that something is happening. Some centers they are doing well, as I said, New is doing well, Gandhi we are covering, Nalgonda, beautiful program, government program that we are covering, training there. Siddipet is excellent program. We saw I think more than 300 babies there and we have treated them. That was also in the newspaper. So yes, so some centers they are doing very well. But everybody has to. Some is not enough.
Thank you. Very interesting. I think this medicine has to be spread as soon as possible. It's really important.
Ma'am, ఈ 30 days screening గా ఒకవేళ 30 days తర్వాత కంపల్సరీ ట్రైనింగ్
అంటే 30 days అంటే ఒక టైం కావాలి. మీరు 30 days లేకుంటే 40 days చెప్తే వేరే 45 days కి వస్తుంది. 45 చెప్తే 50 days కి వస్తుంది. So we have to put a deadline. Unless there is a done deadline, it's not that 31 days, 40 days తర్వాత కూడా అందరికీ blindness అందరితో వస్తుంది. ఎట్లా లేదు. We can still treat, but treatment becomes more complicated. Okay, so first step వస్తే only minimum laser injection ద్వారా మొత్తం క్యూర్ అవుతుంది. లేట్ వస్తే అది సర్జరీకి వస్తుంది. సర్జరీ అంటే మందుకి వస్తుంది, ఆల్ మనీ ఆల్సో మోర్ కాంప్లికేటెడ్ అవుతుంది. సో ఎంత తొందరగా అంటే ఒక ఫైర్ లాగా ఉంది. ఇఫ్ దేర్ ఇస్ అ ఫైర్, యూ డోంట్ వాంట్ టు పుట్ ఇట్ ఆఫ్ ఆఫ్టర్ 40 days. You don't know why 40, why not 45?
Act on time.
On time. So on time, best results, excellent results within 50 days.
What about the kids born as normal kids?
So for normal kids, I showed in the video that normal kids must have the basic 2 tests done. The red glow. And the red glow you can do with your cell phone camera. With your normal camera. Just put your child in a dark room and take a closer picture. So many pictures we are taking.
red glow.
For red glow, yeah. So we should see that red. You saw it. We should see that red. Or at least we should not see white or grey or yellow. So either it should be transparent or it should be red. But it should not look white like you saw there. No? It will look like cat's eye. It's called cat's eye reflex. That some white is coming. So mothers are noticing. Mothers are noticing and they tell, something white is looking. My child was looking at me and I thought there's some white color coming.
What about that case? Can that be treated carefully?
If it is because of cataract, because children can get cataract, or it is early stage of eye cancer, or it is early stage of retinal detachment, we can do it.
And then also red glue?
Red glue is normal. It should be red. Sometimes when we are taking pictures, the red color comes. Now they have removed that red eye from most of the modern cameras, but previously it used to come. That is normal. That is the color of the retina. You can see that.
What is the torchlight test, madam? We can use all this torchlight test.
Torchlight ante just ఇది చిన్న పిల్లలు కన్ను బంద్ ఉంది. When children are born, their eyes are closed. Nobody opens their eye just to see आँख है कि नहीं है. Is it normal size as I showed? రెండు కళ్ళు సమానం ఉంది, పెద్ద ఉంది, చిన్నగా ఉంది, అది ట్రాన్స్పరెంట్ ఉందా లేదా. సో ఈవెన్ వెన్ పేరెంట్స్ కమ్ టు us, ది పుట్టినకి 10 రోజుల తర్వాత వస్తారు, 15 రోజుల తర్వాత వస్తారు, చెప్తారు కన్ను ప్రాబ్లం ఉంది. పుట్టిన రోజు ఎలా ఉంది కన్ను ఎవరు చెప్పలేదు. They are not able to tell us what was the eye on the day of birth. That is the information we want. Is it something which happened in the mother's womb or it happened later? That information we are not able to get because no doctor, no nurse, no parent opened the eye just to see how the eye was. Even that simple test with a torch is not happening. And there is no big technology about it. It's only about laziness. It's only about lack of curriculum. It is not there in our curriculum. It is in some part of the book somewhere. See, the child care book is this big for the pediatrician. Okay, in that some tiny part they will put, check the eyes with torch or do the red flow test. But it is not compulsory. All of you have had to see. Was the eye checked? Did anybody check the eye? Did they say this is the eye of your baby? So they will check the heart. No? They will put stethoscope on every baby. No? They will check the mouth, nose, stomach, everything they will check. No? The eye also has to be checked. We can't leave it for.
There is no awareness also.
Yes, there is no awareness, there is no curriculum. We are asking Government of India to make it curriculum. Now WHO has taken, we are very happy to partner with WHO very recently because of all this shouting that we are doing. Now WHO has made it compulsory in their toolkit. UNICEF didn't have in the toolkit. UNICEF set up 600 centers in the country and in Bangladesh and they didn't put up ROP there. It's not that, I'm sure they knew because that will have international experts, no? So they will do it for their countries, but when it comes to developing...
Was it ignored deliberately?
That story we can tell some other time. There always a story. How things don't come. So the bus will come without seat belt. That happens only in India. I remember there was a story on Volvo bus, it got burnt here when the fire happened. Then they said the exit door for India was optional. If you remember that story, they said the emergency exit door, the company said it is not our mistake, the exit emergency door is optional for India. It is compulsory for Italy. Here the people who bought the Volvo bus, they said we don't need it.
Because human lives are not precious.
No, I think it is because we are not a safety driven country.
They are not focused on that.
We are not focused on safety. So many fires in cinema will happen, every year so many fires in hospital will happen. So many floods will happen. No, we are not somebody who is very much like those of you who have travelled abroad. You will see fire drills, fire equipment, exit everywhere, whether it is a small shop or a big shop or a hospital. Regular safety. So we don't have that safety mindset. Is not there. We are not investing in safety. We want scooters, but we don't want helmet.
Now things have to change.
We hope. It took death of somebody like Mistry, to say that seat belts are required for packed people. I went to Japan. The driver told, as soon as I sat in the taxi, he said, for your own safety, please put the seat belt. Here driver will say, madam, chalana rahega, isliye seat belt are off. That is the mindset. So they will say, udhar to traffic police nahi hai. You go to Japan, there is no traffic police. There is no traffic police in Japan. They don't need.
Do you also have a soft copy of this application?
They are building, I think.
Yeah, we are building the e-copy. So it is still in production. It has not got a final go for it.
Well, it's good for reading, but once carrying again, to different places if we want to create an OAS.
Digital platform will be releasing soon.
If you can please send it to.
Yeah. Once it is released, it will be Amazon, whatever. But anyway, you have time. You can just open and see. I hope you are not scared of that blood, but it's just to say that yes, we can see. We are actually seeing what is happening. And the other thing which we didn't say was that see the cameras that we have, contact cameras for babies, They cost between 18 lakhs to 80 lakhs, which we take to the NXUs. 18 lakhs, which is made in India, we're very proud again, that is made in Bangalore for us. And the one in America, that is 180,000 US dollars, which is about 80 lakhs. So, but these cameras, doctors have to buy separately for babies. What they have shown is that this is the same camera which we are using for adults. So, any doctor who is not having big practice of babies, he has only few babies, they can use the adult camera only. So, they don't have to buy separately.
You mean a basic version?
The basic version of any camera which they are using in their clinic for diabetic retinopathy.
How affordable is that?
There also the price is different. It is from 20 lakhs to, it can go to 20 lakhs. Yeah.
For a nursing home to go ahead.
No, but see, the eye specialists, they do so much of other diseases, adult diseases. Like diabetic retinopathy, they have.
For a full-time practitioner.
So for full-time practitioner, what they have shown is you don't need to buy separate camera for babies. You don't have to invest. You can use the adult camera only in that blind baby position, and they have shown how to do it. And that, I think that is the biggest advantage.
Could you share the presentation of yours and the video as well?
Yes, videos are already on the net.
Okay.
As I said, it's LVPEI. It is on our website also, but she can send it there.
I will share the link.
Presentation is quite interesting.
Yeah.
That you can put it.
Yes, we are happy that is definitely, but you can take that. There is no copyright on any of my work. And there are posters here, these are self-sticking posters. Please take them, put them in your apartment, put them on your car, put them in public places with your hospital friends, your doctor friends, so that everybody knows. Again, there is no copyright on this. So here we have put our LVPEI logo. We have no problem if people stick their own hospital logo here. They write in Telugu or Odia here. There is absolutely no issues with that. This is all by Government of India and by some company who is giving this. We have no issue. If somebody wants a soft copy, they want to put their own hospital logo, their own company logo. Absolutely.
And you can also share that also in soft copies.
These soft copies are already available on my Facebook page, but Neha can.
They're on the website. I'll share.
They're all on the website. Every material is on website, freely available to anybody in the
So
world.
what we request is if it is sent through email, then we can officially kind of correspondence.
Yeah.
So that then we can also claim that in the
Rather
house.
Telugu wala also. Psychic and
Rather than
really
going
hard.
and downloading it from some app.
No, sir, standing.
आप लोग तीनों ही पकड़ के खड़े होंगे देख
ఇప్పటికి కూర్చోండి మీకు కాదు ఓన్లీ డాక్టర్ సార్ సార్ కూర్చోండి సెల్ ఫోన్ 1 సెకండ్ సెల్ ఫోన్ సార్
These things are good eyesight is every child's right. I tell children don't go blind because they cannot tell. They don't have a voice. That's why they become blind. They don't become blind because we don't have the technology or we don't have the money. There is no problem with money, technology, doctors. They don't have a voice. We all have to be the voice of our minds.